So today we're here in one of our 3 cath labs with Cedar River Health System with one of the legends of our cardiac program, along with Brenda, who manages our cardiac program, and also one of our long-standing team members, Sonia, who helps serve with heart and soul here at Cedar River Health System. But we just want to talk a little bit today on the 411 about some of the things that make the program really great here.
We've just been awarded, the most comprehensive program between our 3 hospitals on the coast in cardiac care. Dr. Zayad, he helped found this great program. What are you most excited about this program going in the future?
Well, I think all the great things that are happening to our program with us having now a good structural heart program, quite a strong structural heart program. We have 3 interventional cardiologists that are doing structural heart. And in addition to the interventional and non-invasive cardiologists that are available here that offer all aspects of care with regards to cardiovascular diseases.
We can do things that can't be done in other places. We've got one of the only structural heart programs in this near this region, and that's one of the things I think that makes us A-rated. And also our outcomes. We've got really good scores, and you and the other cardiologists, I think we've got 11 cardiologists that all collaborate. Tell us about the collaborative process and how that makes the overall program a higher level of quality and got us that A in Leapfrog.
I think really from the start, we felt that working together is much better than competing against each other, and that is really why we have been successful in achieving what we have achieved to this point. We all cover each other, we help each other during cases, and I think that is the most important thing. It reflects well on us and reflects well with regards to the quality of care that we can deliver to our patients.
Yes, and amazing outcomes. And I think it would be good to explain what is a cath lab. The average person probably doesn't know what we mean when we say that. So, Sonia, do you want to explain a little bit where we're at?
Well, most people think of the cath lab as a heart cath lab, which is the main thing that we do here in the cath lab. But we also do many other things. Just like we were talking about now, we also do structural heart. But we mostly do diagnostic interventional heart caths where we look at the coronary arteries, fix anything that might be narrowed. We also do peripherals, which is legs. We do pacemaker implants, device implants for people with bradycardia and problems like that. We also do venous cases for DVTs. Pulmonary embolus, which is something new that we have started. So we do an array of things, not only heart caths.
The whole spectrum. And it is pretty amazing, the structural heart program where they can go and do things that used to require open heart surgery now can be done with today's technology. But tell us about the simple things that we do. Like, for example, maybe even in your office, let's say somebody's out there and they've got a tingling in their arm, the left arm, right?
The left arm.
What should you do, and how do you help with that?
Really, the patients need to know what the risk factors are. The more risk factors an individual has, like they're smokers, they have high blood pressure, they have diabetes, they have a family history of heart disease, high blood pressure, high cholesterol, they need to be more aware that they are at risk of developing heart problems. And if they have any discomfort in the left arm or the right arm or the chest or in the back between the shoulder blades, or they're feeling fatigued or more short of breath than usual, I think they need to be checked. Everyone needs to have his risk factors under check and to also seek medical care when they have any suspicion that it could potentially be a problem related to the heart.
So the best thing is to stay out of the cath lab, and maybe we can do that with just a simple EKG.
EKG could help, a more advanced form of an EKG, which is what we call a stress test. We do that in effort, let the patients walk on a treadmill, and see what the EKG looks like. We may inject some radioactive material to get a better picture of the heart and make sure that the blood flow to the heart is normal. So very, very important really that everyone, especially individuals that have strong risk factors, that they get evaluated by either the primary care physician or seek care at a cardiologist to be evaluated, and then we can always sort what risk they are at, and from that point we can go ahead and perform procedures if needed.
How often do you see someone come in that when they had the slightest symptom, a little bit of chest pain or tightness or the tingling in the arm or just some small rhythm issue, if they had come in earlier, how often could that have saved someone's life or made them have a better outcome?
It is always good to intervene early because there's a lot of things we can do to abort a heart attack and reduce the risk of you progressing any blockages in the arteries of your heart. Controlling your cholesterol, controlling your blood pressure, definitely smoking cessation, exercise and avoiding, just couch potato syndrome. All these things are very important for us to achieve health for our patients.
Yes, and heart problems can happen at any age. For myself, I actually have a leaky valve that I was born with and didn't find out until, I had another screening, and thankfully I did, and I go every year and get the stress test, and everything goes pretty well so far, and it makes me very happy that I know that there's a great team here that if there's something that was to happen.
Sonia, how long you been here?
I've been here at the hospital almost 40 years, here in the
What?
here in the cath lab for 20 years, like Dr. Zayed. I helped
She's
start
been here
the
longer
cath
than you.
lab.
Yeah, she was
Yeah.
a BR.
How long have you been here?
I helped raise it.
26,
26.
But
So
she's been more
tell
than-
us real quick as we wrap up, why do you love your job? Why do you love work? Why'd you stay so long?
I can't imagine doing anything else. Once I found the cath lab, of course, heart is my passion, and then I've seen it grow so much. I mean, we started out as just a diagnostic lab, and then we started doing interventionals, and now we've just progressed. I mean, as a nurse, I have never stopped learning in this field, and now we're doing structural heart. We're doing all these things that you see at big universities, and so now we're doing it right here at Ocean Springs.
What about you, Brenda? What do you love about working here at the Singing River team?
I really love the continuity of care. We can go from diagnosis all the way to replacing a valve without you ever having to be open. We are focused on improving outcomes, patient safety, patient satisfaction. We have an amazing team of both cardiologists, nurses, techs, that if you need us, we are well prepared to take care of you, and we'll provide the appropriate care, the spectrum of care that you need.
I know you love working here, Dr. Zayed. Why do you love it so much?
Well, I love it so much because this field is very, very interesting. A lot of progress, a lot of changes happening since I started years ago before the stents were even available. Now, a lot of things could be done by small needle sticks rather than opening the chest. And really, particularly with regards to our program here, really, you guys have been quite progressive in going the next step in order to make us at the cutting edge. Right now we have actually 5 cath labs, 6 cath labs.
That's true, total, between the
Between
three
the 3
hospitals.
hospitals. We're very excited about Gulfport having our Singing River Hospital over there, and I think we are going to be offering a lot of what we have experienced in our end of the state here to our Gulfport patients, and I think this is very exciting, seeing something new taking shape.
Well, heart care is a core competency for us. It's really one of the leading things that we do. It's one of the things we're absolutely the best at, and it's thanks to a lot of experience. I didn't realize 40 years. That's amazing, and 26 years, and Brenda and your leadership, and so many other people that have so much experience here, and some great doctors, great nurses, and a great overall team.
Right, so
That's what we're here for.
So don't skip a beat. Call our cardiologist and get checked out.
Stay Singing River strong.
That's right.